Hello and welcome. The objective of these trainings are to introduce providers to the New York State Vaccines for Children program, otherwise known as the VFC program. We will begin the training by covering the background and history of the VFC program. This training will also emphasize the importance of identifying and training key staff as required by the New York State Department of Health VFC program and to describe the responsibilities of each key role. And lastly, we will review all of the New York State VFC training requirements. VFC is a federal entitlement program that began in 1994. After the introduction of the VFC program, vaccine coverage rates for all children in the United States increased rapidly. The program removes financial barriers hindering vaccination of VFC-eligible children. The New York State VFC program provides federally supported vaccines to eligible children. The vaccines are distributed to enrolled VFC providers at a variety of clinical settings, including private medical practices, hospitals, local health departments, and federally qualified health centers, and they are then administered to eligible children. Providers may also obtain other publicly funded vaccines to serve children eligible under other criteria. Types of publicly funded childhood vaccines include federal VFC vaccine, New York State-funded vaccine, and CHIP, otherwise known as the Children's Health Insurance Plan funded vaccine. VFC providers must screen all patients birth through 18 years of age for VFC eligibility and document the eligibility status at each immunization encounter. Who is eligible to receive VFC and other publicly funded vaccine? To start, only children under 19 years of age are eligible for VFC and other publicly funded vaccine. The column under the VFC funded in this chart displays the eligibility criteria for VFC funded vaccines. A child is eligible for VFC vaccine if the child is under 19 years of age and the child is enrolled in Medicaid, including both fee-for-service and managed care plans, or the child is uninsured, or the child is underinsured. For example, a child who has commercial insurance which doesn't include vaccine coverage, only includes select vaccines or caps vaccine coverage. Underinsured children are eligible to receive VFC vaccine only through a federally qualified health center, also known as an FQHC. Or, lastly, the child is eligible to receive VFC vaccine if the child identifies as American Indian or Alaskan Native. The state-funded column in this chart displays the eligibility criteria for state-funded vaccines. A child is eligible for state-funded vaccines if he or she is younger than 19 years of age, is underinsured, and being vaccinated at a provider other than a federally qualified health center. New York State allows private providers to vaccinate underinsured children using state-funded vaccine. The CHIP-funded column in this chart depicts the eligibility criteria for CHIP-funded vaccines. A child is eligible for CHIP-funded vaccine if he or she is under 19 years of age and enrolled in the Children's Health Insurance Plan. Providers must be enrolled in the New York State Department of Health VFC program to receive VFC and any other publicly funded vaccines. The Advisory Committee on Immunization Practice, or ACIP, is a group of medical and public health experts who develop recommendations on vaccine use in the United States. ACIP's statutory authority is to develop recommendations for U.S. immunizations, including ages when vaccines should be given, the number of doses, time between doses, and precautions and contraindications. ACIP also approves and determines the specific recommendations to include a vaccine in the VFC program. These recommendations are written in the form of a VFC resolution. VFC resolutions passed by ACIP form the basis for the VFC program policies on vaccine availability and use. After a VFC resolution is in place, the Centers for Disease Control and Prevention, or CDC, establishes a contract for the purchase of the vaccine through the VFC program. While VFC vaccine is provided at no cost to enrolled providers and eligible children, it should never be considered free. Funding for the VFC program is allocated through the Centers for Medicare and Medicaid Services, also known as CMS, to the CDC. CDC buys vaccines at a discount and distributes them to grantees such as New York State, which in turn distributes them at no charge to enrolled VFC providers. Providers who participate in the VFC program must comply with the ACIP immunization schedule, dosages, and contraindications. The only exception is in the provider's medical judgment, and in accordance with accepted medical practice, the provider deems such compliance to be medically contraindicated for the child. New York State VFC providers must offer all ACIP-recommended vaccines for the populations they serve. The link on this slide, and on the resources document included with this training will bring you directly to the ACIP immunization schedule. Each enrolled VFC provider must identify staff in key roles. These include the medical director or equivalent, the primary vaccine coordinator, and the backup vaccine coordinator. In the upcoming slides, we will review the responsibilities associated with each role. But first, it's important to note that the staff in these roles are the primary contacts for the New York State VFC program. Therefore, the New York State Department of Health must always have a current full name, phone number, and email address on file for the staff person assigned to each role. If there are changes to staffing or contact information, you must update your provider agreement in NISUS. Providers must complete annual VFC trainings as part of the annual recertification process. Now let's take a closer look at each of our 3 key roles, beginning with the medical director or equivalent. A medical director or equivalent, defined as a practitioner authorized to administer pediatric vaccines under state law, must be identified, and this will be the first person listed on the enrollment form and provider agreement. Any further references to the medical director in this or any other VFC trainings will refer to this definition. This person signs the provider agreement and is aware of all New York State VFC program requirements. This person oversees or is directly involved in the clinical aspects of vaccination activities and understands the clinical implications of mismanaged storage units and vaccines, and is accountable for the entire provider location's compliance, including site visit participation and educational requirements. The primary vaccine coordinator has primary responsibility for all aspects of vaccine storage and handling and is an expert on all vaccine-related standard operating procedures, known as SOPs. They must read and be familiar with the information in the VFC provider agreement, the vaccine management plan, resource materials posted on the New York State VFC website, and any other communications sent from the New York State VFC program via mail or email. The primary vaccine coordinator should work on-site most business days, as this role requires daily temperature monitoring of vaccine storage units as well as other hands-on responsibilities such as rotating and reconciling vaccine inventory. They also act as the provider's contact for the New York State VFC program, including during site visits. They must participate in training on VFC program requirements and train all staff at the practice on proper vaccine storage and handling. Primary vaccine coordinators are also expected to obtain and maintain a New York State Immunization Information System, otherwise known as NISUS, account, and complete required reporting in NISUS. The primary vaccine coordinator ensures that all necessary documentation and reporting is properly completed, including but not limited to eligibility screening and doses administered reporting. Doses administered must be reported in NISUS within 2 weeks of administration per public health law. The primary vaccine coordinator keeps the medical director or equivalent informed of VFC program requirements and all compliance issues. They also notify the New York State VFC program immediately if there are changes at the practice, such as a change in the primary or backup vaccine coordinator, a practice name change, the practice is moving to a new location, practice is being sold, physician is retiring, practice is merging with another practice or becoming part of a larger organization, patient profile changes, and so on. The primary vaccine coordinator may delegate some tasks to other staff. In that case, the primary vaccine coordinator must train the identified staff on the delegated tasks and document completion of this training. Please note that as trainings are now located in the New York State Learning Management System, or LMS, each additional staff member must complete their own training and retain copies of completion certificates. Ordering and receiving vaccines is a key responsibility for the primary vaccine coordinator. To place an accurate order, they must perform a physical inventory of all vaccines on hand and account for doses of any returned or wasted vaccines since the last order. Coordinators must be present when a vaccine is delivered and immediately process it into inventory and ensure that acceptable temperature ranges have been maintained. If the primary or backup coordinator is not available, they must designate a trained substitute to handle vaccine deliveries. Refer to training number 11 in this series for detailed information on vaccine ordering. The primary vaccine coordinator is responsible for the storage, documenting, and management of vaccine inventory. Managing vaccine inventory is covered in further detail in training number 10 of this training series. Vaccines are to be kept appropriately in the correct storage units. Vaccine inventory must be rotated so that vaccines with shorter expiration dates are used first. VFC vaccine must be labeled and kept separate from private vaccine stock. The primary vaccine coordinator must also ensure that there are no expired vaccines in the units and perform routine cleaning of vaccine storage units. The primary vaccine coordinator is responsible for monitoring and recording vaccine temperatures. This includes the following duties: setting up and using a certified calibrated temperature monitoring device to review refrigerator and freezer temperatures, checking and recording minimum and maximum temperatures at the start of each workday, reviewing and analyzing temperature data at least weekly for any shifts in temperature trends, and responding to temperature excursions by taking immediate action to report temperature excursions to the New York State VFC program at vaccineTempExcursion@health.ny.gov. The primary vaccine coordinator is responsible for maintaining all paper and electronic documentation, such as inventory and temperature logs, for a minimum of 3 years, overseeing proper vaccine transport when necessary per standard operating procedures, overseeing emergency preparations for standard operating procedures, including tracking inclement weather conditions, implementing the emergency vaccine management plan if necessary, and ensuring appropriate handling of vaccines during a disaster or power outage. The backup vaccine coordinator performs the primary vaccine coordinator's duties when the primary vaccine coordinator is absent, and otherwise assists the primary vaccine coordinator as needed. This person is trained and proficient in all areas for which the primary vaccine coordinator is responsible, is an expert on storage and handling standard operating procedures, and again, should work on-site most days that the provider office is open for business. Please do not name the same staff person as the primary vaccine coordinator or backup vaccine coordinator for multiple sites, as the staff in these roles should be physically present most days to carry out their responsibilities. Aside from the designated primary and backup vaccine coordinators, all staff receiving deliveries, handling and/or administering vaccines must know the correct vaccine storage and handling requirements. It is encouraged that all staff complete the annual trainings. As indicated previously in this training, all staff trainings must be documented. Training must be completed by newly enrolling providers each year for the annual provider recertification and any time that there is a change to the existing vaccine coordinator, the backup coordinator, or medical director or equivalent. New staff in these roles must complete all of the trainings. The name of the trainings, staff who participated, and the dates of trainings must be documented and maintained by the provider. And please note that all changes in staff must be reported to the VFC program immediately. This slide displays which VFC trainings in the New York State Learning Management System are required for newly enrolling providers, changes in staff, and the annual recertification process. The medical director or equivalent, primary and backup vaccine coordinators all need Health Commerce System accounts and access to NISUS. After HCS access is granted, the medical director or equivalent, primary and backup vaccine coordinators should take both the NISUS standard user and administrative user trainings to prepare them for ordering vaccines, accepting shipments, monitoring vaccine inventory, entering doses administered, entering vaccine returns and wastage, and generating reports for internal review. A NISUS training quick guide link can be found on this slide and in the resources document included with this training. The key messages of this training are: each VFC practice is responsible for designating a medical director or equivalent, a primary vaccine coordinator, and a backup vaccine coordinator. Vaccine coordinators are responsible for many vaccine inventory management activities, including ordering, receiving and storing vaccine, returning vaccine, monitoring vaccine storage unit temperatures, and maintaining up-to-date information in NISUS. Each medical director, primary vaccine coordinator, and backup coordinator must complete annual VFC trainings to participate in the VFC program, and all staff who handle or administer vaccines must be adequately trained as described. Thank you for participating in this introductory training to the New York State Vaccines for Children program. Any questions can be sent to NYVFC@health.ny.gov.